The Commissioner for Health in Enugu State, Dr. Ikechukwu Obi, joins us via Skype on the state's response to flattening the curve. Dr. Ikechukwu Obi, welcome to the program. Let's begin with the 72 health workers contracting COVID-19. Has that number increased, and what happened?
Okay. Essentially, what is happening is that we're keeping our records in the Enugu State response for COVID-19, and actually, the numbers for healthcare worker infections have increased. But let me clarify: the healthcare workers we are speaking of are the healthcare workers that are working in some of our public facilities and private hospitals also, and they are not necessarily the health workers at the front line that are attending to the COVID-19 patients. So a lot of the health worker infections we have reported are people who happen to be health workers in the peripheral care facilities who have also come down with the COVID-19. We are reporting this just to allow people to understand how serious this condition is, and to also buttress the fact that nobody is actually free from possible COVID-19 infections. And incidentally, I just want to point out that despite the training that we have done on infection prevention and control, the information and support that has been provided on COVID-19, COVID-19 is what it is. If we listen to all the other media, even in the other developed world, health sector strategies around the world are being overwhelmed, and healthcare workers are getting infected. So it will be surprising for anyone to think that Nigeria will be different in this matter. But I want to state categorically that the frontline healthcare workers, we haven't gotten any reported case amongst our frontline healthcare workers that are engaging with the COVID-19 cases yet.
So when you say healthcare workers are infected, what is the number as at today?
As at today, our healthcare worker infection rate we have 83.
How much more is the state government putting in place to protecting frontline workers, and not just them, all health workers in Enugu State?
The healthcare workers under the employ of the Enugu State government, the government has put in a lot. For example, when it comes to the welfare of the health workers, the healthcare workers are on a group life insurance that has been set up for the healthcare workers in the states. And when further on welfare, I can tell you that the healthcare workers in the states have continued to receive their salaries on a steady basis. And then the state government even put in a 25% increase in the basic salary of healthcare workers and emergency care workers in Enugu. Personal protective equipment has been supplied continually by the state government to the isolation and treatment centers specifically, and then to other support with PPEs have been provided even to peripheral hospitals. The government has sponsored training on infection prevention and control. And then from the State Ministry of Health, we have insisted to the hospitals around that they should put in triage practices in the sense that they should have holding areas and then be able to do a triage of patients to be able to identify possible cases of COVID-19. And we have provided the emergency numbers to all healthcare facilities and healthcare workers so that they will always call the emergency numbers and get to the rapid response team and not have to risk themselves with patients. And for the frontline healthcare workers, they are on a special allowance. They are being housed so that they will not treat these patients and then go home to their families and possible risk infecting their families. And then they are even provided with meals. And this is what we have been doing, as a government, to be able to protect healthcare workers as much as possible. So much is still being planned, and we keep responding to this as it continues to persist.
All right, Dr. B, the extension of the second phase of lockdown is by the federal government. How does this affect Enugu's response to tackling the spread of the virus?
Well, the response is a national one. And then the state governments are also doing their bits, to join in with the national response. So with the extension, we agree with it. It does not really affect our response as a state. We will definitely continue as a state with our efforts at risk communication for prevention so that people will take responsibility and do the right things to reduce the number of infections that we will have. We will continue to identify cases as they come, either by calling on people to come and test when they feel that they have reason to test, and identifying cases by even contact tracing of the cases that we have come across. And then we will continue to isolate and treat the patients that we confirm are COVID-19 positive, and then we will work hard to ensure that they are treated, get better, and following the criteria that has been put forward by the NCDC, discharge them when they are good and fit to go home.
We'd like to thank you, the Commissioner for Health in Ogun State, Dr. Ikechukwu Obi. Thank you so much for joining us on the program. We wish you all the best as your state continues to battle COVID-19.